she has introduced artificial intelligence inside dentistry. Hello everyone, once again I'm back with another ecstatic episode of Electica, the Different News. Today I have an amazing personality with me whom you can see on screen already. So my guest today in this show is Dr. Padma Gadiyar, and she is the CEO and founder of SmiloAI. Well, I'm not going to describe what is SmiloAI, but I can just describe in one line this amazing lady who is sitting virtually in Brisbane, Australia, but we are connected through technology. So she is gorgeous, as you can see that, and she is an entrepreneur, and what she has done is revolutionary. She has introduced artificial intelligence inside dentistry. Welcome, Dr. Padma, and thank you for accepting my invitation in this show. I'm very grateful to have you here today, and it's a privilege to talk to you today in this Eclectica, the Different News show.
Thank you for having me, Gagi. I've been a big fan of yours. I've been following your work with saliva and everything that you do with the salivary technology stuff. And I've been a big fan and following your work for the last 2 years. And it's great to be on your show today.
Thank you. So, Dr. Padma, I do not know much about artificial intelligence. So maybe we can start to understand from you that little bit what exactly SmiloAI is, and maybe then I'll start shooting my questions to you to learn more from you.
So, Gagi, I've been a dentist for last 11, 12 years now. Been into private practice, multi-practice ownership. Even I wrote a book on practice ownership for dentists here. Then have been consulting in over 300 dental practices in the last 3 to 4 years. I saw a common thing across the practices was there was a problem in how you are communicating with your patients, whether it is in your room or once they leave your practice, right? So that gap was quite obvious for me, whether it was a dental practice here in Australia or the US, India, that gap was quite common. And on the top of that, after being a dentist for such a long time, you realize when you go through a lot of other places as you're traveling, there is a gap of accessibility of oral health care. And that was constantly bothering me because I knew the 3 reasons why people hate going to the dentist is firstly dental anxiety, because you are associated, you think of needles and sharp instruments as you think about dentistry. Dentistry is not covered by a lot of insurances, Medicaids, and it's quite expensive as an out-of-pocket expense. And third is the availability and the convenience of accessing care. So all those things was quite was giving me a profound thinking. I was thinking, how can we make this possible all in one and make patient the center of everything? Because in the way dentistry works is dentists are the center of everything, right? But we have all realized during COVID-19 now, if a patient doesn't walk into our dental practices, we totally don't have a business model, right? So for me, even before COVID, I was thinking, how do we make our oral health care patient-centric? So that's when I came across artificial intelligence. I looked at smartphone technology because at that time I read an article which said there are 2 billion toothbrushes in the world and 2.4 billion smartphones. So I said, we've done toothbrushes for over 100 years. So let's see what smartphones can do. And at the same time, I was introduced to artificial intelligence by a very dear friend. And I was like, this is amazing. This is great. If we can work out artificial intelligence, computer vision, and smartphone technology, this can be a great point of care and remote monitoring virtually with real-time insights for any patient. And that data could be gold for a dentist because you're getting all this information even before a patient visits your practice. So you exactly know what a part of your treatment planning as well as a part of your communication. because otherwise a patient walks in, we are so absorbed as dentists to get them out of pain and solving that one problem for them, we forget the holistic approach.
Correct.
So this gives them that ability to manage time better, manage the patient as a whole, and at the same time patient is more educated that okay, the dentist becomes like a validator for the problem, patient is pre-screened, pre-triaged. So there is a lot of aspects that SmiloAI covers. It's a virtual care platform using smartphone and AI technology where patients can take their mouth selfies, remotely assess what's going on, and then communicate with their dentist at their home, at their own time, and get some real time insights. So my vision was to make dental care accessible, affordable, and more fun.
Excellent. Excellent. I think this is amazing. I mean, this is a revolution in itself. You actually took up a very simple thought process and you came up with the solution to a pertinent problem that is existing and doesn't require any boundary. It's global. Amazing, amazing. Exactly, like you mentioned that you had your dental practice. Well, that is an entrepreneurial journey by itself. But now that you are moved into a little different domain, so what exactly was the start point of your entrepreneurial journey?
I think my entrepreneurial journey started when I was 10 years old. I sold an apartment. My dad was into building and construction at that stage, and I sold the first apartment for my dad. I think my entrepreneurial journey started then. If I have to ask, if I have to tell you the start point, but I was always inclined towards business aspect of things, more than dentistry. Though I became a dentist, I was always more into the business of dentistry. And then moving from practice ownership to technology, I think it was September 2019 as I returned back from the US after my beauty pageant. And I looked at the concept I was working on at that time for like 3 months. And I said, yes, this is the time, because as a dentist, you can probably treat 8-10 patients a day. As a practice owner, you could probably treat 30-40 patients a day. You have multiple practices. You could treat 100-200 patients a day. But with this kind of a solution, you can treat millions a day. You can have that global reach. You can create dentist without borders. You don't have to create any fear or fear of judgment.
Correct.
Not just fear of instruments or pain, fear of judgment. So many patients think we are quite constantly judging them. So I was like, I'm able to break the barriers of accessibility of care through this technology. So that is exactly when I said, yes, this is something I would like to pursue and see how far I can take it.
It's a very brave step that you have taken, and very few people actually can materialize their ideas into reality, which is a real challenge, and it needs a lot of courage. And I congratulate you on that. Actually, my second question to you is that okay, like as you told that I understand the background story, but from where did you get this idea of introducing artificial intelligence or AI into dentistry? Because this we are not connected some way. These two streams are not connected, and even now in healthcare, we do see or many things have been happening from the past few years. As a dental fraternity, we are not much exposed because we never study or never listen or never hear this terminology. Now that data science and AI is happening, we see so many courses coming up, and also now I think a little bit we know what it is. We delve in to at least know the definition of it. So my question is that how did you get this idea of introducing AI in dentistry? This is something which always hits my mind whenever I see you in your social media and all those posts that you do. I mean, that is one thing which I'd like to understand from you.
Look, AI has been a part of all our lives from a banking perspective for a very, very long time. But for me, I saw while I was in the US in March 2019, I saw my friend explaining what AI was doing in the retail space. They were coming out with a solution for barcoding and stuff like that. And when he was explaining to me the process, all I could see was dentistry. The exact user experience or patient experience that we call it, the patient journey that we call. It was absolutely, when he was explaining the retail stuff, in my mind, I'm thinking this is the same thing that happens in dentistry, because dentistry is out of pocket expense, right? So I was like, this is dentistry is retail. So that was the first light bulb moment for me, to be honest.
Amazing.
I had no connection to technology till then. I'm not a techie. I'm not a technology person. I don't have anybody in my family who's into technology to an extent that I have gone now. So for me, that was the light bulb moment. Then I came and researched what was happening in dentistry with respect to AI. And I figured out there was a lot happening in radiology.
Right.
With respect to identification of dental caries or periodontal disease on radiographs. It was a good aspect, and I could see there were about 6 or 8 companies, particularly located in US and Canada, that were doing that work. Then I looked at it. I did a lot of research on those companies as well to figure out what's that particular niche was missing so that I could pursue that. But then I realized, for that to work on a scale I wanted it to work, we were totally dependent on patients walking into the dental practice.
Correct.
And X-rays is not something you can take every day or every 2 weeks. There is the Alara principle and everything, right? And even with respect to the PAs or bite wings or OPGs, only 50% demineralization has taken place. It appears on the X-rays. And X-rays is not something we patients cannot understand, the gray, white, black, the light gray, the dark gray. Of course, we are taught, but they don't understand that. So I was like, I'm not able to solve the problem of patient communication, patient education here. I can't provide remote patient monitoring or virtual care through this one. Then I went back and I said, reverse engineered, this is how I want it to look. So if it wants to look like this, how do I reverse engineer? What is the sort of data I want? Because by then I had already spoken to about 12 different developing teams in the world, all overseas, Australia, everywhere. And I knew that there was technology available to do what we wanted to do. So that is when you realize, as you are going through this process, AI is just a tool.
Correct.
As long as you understand what the end user's vision is or end user's journey needs to be, there's a lot of technology available outside. And AI was not the only thing we were looking at that stage. We looked at augmented reality, virtual reality, how we can combine AI and VR, right? So, of course, there is a lot of product milestones that we have, and there is a lot coming in the future. But that was a simple tool of AI. AI is, I think it's got a lot of mileage at the moment in the market, but I don't see AI to be an extremely different technology. It's just another technology that has come into place. How we use it and for what we use it, I think that's going to make or break any technology.
Right. You're absolutely right. Very, very well explained, actually. So, as an entrepreneur myself, this journey, I mean, as I always say, Padma, that this term entrepreneurship is very catchy. It's very nice to listen, but it's just like, you are put in the middle of a sea. So, in that aspect, I am pretty sure that you have been facing challenges, and you do face challenges at this point also. What would be the 3 most important challenges that you would like to tell us, which was really, really hard for you, and which generally leads us to something called as procrastination or frustration? And at some point, we think that, no, I think I'm not correct. I should leave whatever I'm doing. So maybe if you can just tell us that, because I think it's a lot to learn how exactly you cope up with all these situations, and it will be very inspirational for all of us.
Look, there is a couple of days in a week, or a couple of moments in a day when you think, oh my god, what's going on, why am I doing this?
Yes.
And I agree with you, Gagi, that entrepreneurship, just like AI, is a buzzword.
Yes.
I don't think there is any shortage of entrepreneurs in the world. I look at people who are more executors, who
Right.
will turn that idea into something. I have no problem if somebody fails,
Mm-hmm.
but if they call themselves as an entrepreneur based on an idea, that's where I'm not interested. Right. So
Right.
as a startup founder, or a first time tech founder, for me, my
Mm-hmm.
biggest challenge was I came from a clinician background. I knew the industry, I knew the profession really well, and I knew what the vision is.
Mm.
It is your channel partners, distributors, or investors
Mm.
having that clear vision that is sharp and concise has been my biggest challenge, to be honest. And the reason for that is because we are in the patient experience, how the dentist experience is, and how this is about breaking, thinking outside the box, breaking the barriers. But as a commoner, it is so hard to understand what problem you're solving. Doing everyday work with your product, with your vision, that you get carried away.
Yes,
Right.
I
So,
agree.
and you think you know, but the other person doesn't know. So it becomes a communication error, right?
Right.
The second biggest challenge for me was to find the right team and
Mm.
the people
Mm.
around you, because people's resumes tell a lot of things, but that doesn't need to be true in many ways. And to put up with your passion,
Mm.
you need people with the same wavelength.
Yes, yes, I
So
agree.
finding that good match, and all that. And because as we started developing, we came across COVID-19.
Mhm.
So from forming a team that could be face to face, to running 3 different remote teams, which I was not used to. I'm used to running a dental practice,
Right.
and now trusting them with the work that you are supposed to do with your vision. So
Mm.
that has been my learning curve, and has been my biggest strength, I think, in this journey.
Mm.
And the third most important challenge is because you have run a business that is so easy to run, to be honest. And now you're cracking this code with commercials, and trials, and getting through compliances, your IPs.
Right.
So financials, projections, it's like doing a mini MBA.
Absolutely.
And though I came from a very good understanding of numbers, because I loved the business of dentistry,
Mm.
that was at a smaller scale. Now everything becomes at a bigger scale, corporation, and
Mm.
compliance and legalities are much more harder here. So having that open-mindedness was so important. This journey has made me personally quite humble,
Yes.
quite very humble, and I think I'm a learner now every single day.
I think
I
I
feel
Yeah, I think I'll take that word from you, and I totally agree because I think whoever has gone in a true entrepreneurial journey will have a same sentence or experience that comes out of their mouth because I think it's about unlearning and again relearning. I mean,
yes,
you just become like stem cells. You have to become pluripotent to become
yes,
anything, any cell again. So it's complete reprogramming or rewiring of whatever belief system or whatever knowledge that we have. So I think I totally agree with you. I mean, I think that's the essence of entrepreneurship and
really good in handling stress now.
correct, correct, correct.
I've become really good in handling challenges, failures, stress. Does it still bother you? Yes, it does. But because this journey is so um, entertaining, I would say, because there is like this heartbeat up and downs that goes on. It's so entertaining that you don't even have time sometimes to what is that, grieve over your failure. there is something next moment that comes up that you have to go and address.
Yes.
Simple thing, we've had a great week this week, and then yes, of course, with the great week comes what's next challenges, or how do you prepare for the next upcoming few weeks. And I did tell my team just yesterday, let me for a moment enjoy it. We'll discuss this in the stand up on Monday. But
Right.
for a moment, let's enjoy this,
True.
because we are so engrossed what's coming next,
Mhm.
right? Forget the small wins that we've had. And
Right.
I'd say, to boost everybody's morale and confidence, I think let's stop for a moment, take a step back, and look at how far we have come
Correct.
and enjoy it for a moment. So, as an entrepreneur, this is my 2 cents for everybody. You will need to stop at some stage. Although I'm like forward thinking person, I look forward, I'm focused, I'm determined. Sometimes you need to stop,
Yes.
look back for a moment and say how far you've come, and give
Absolutely.
a pat on your own back.
Exactly. I agree. 100, 200% I agree with you. And just to conclude our conversation today, now that you know that we have many dental graduates coming up, and maybe by seeing this particular interview and by seeing you, I'm pretty sure that you have a very big fan following. And just taking that part ahead, can you suggest few things? Suppose today, if a dental graduate who has just graduated and they're fresher, or they are maybe aspiring to do something different, thinking out of the box, so is there a pathway maybe which you followed, where a dental graduate can actually do maybe what you did, not exactly what you did, but taking up this kind of a pathway, or maybe delving into AI, or thinking in something which would really solve a real problem existing in the society? So I think that would be a very good insight for everybody, because which when it is coming from a person, an expert like you.
Look, there is a lot of challenges that is happening, and now that we are having implementation trials, now we're going into commercialization. We identify more and more issues that we can solve,
Mhm.
whether it is from a patient perspective, whether it's from a standard operating procedure perspective, digital health effectiveness, better productivity perspective. So for me, if I were a new graduate at the moment, I'd look into all these things. How is the operations happening? How is the care delivery happening? I'd be looking at retail, banking,
Mm.
e-commerce at the moment, and
Mm.
seeing what is it they are doing right that we can bring into dentistry,
Fantastic.
right?
Mm.
Uh, so for me, it is constantly about being curious and finding out what are they doing better in something totally different, like airlines industry. i'll
Right.
I, I'm very curious how that effectiveness works in airline industry, right? So I'm constantly exploring. There will be something that we can learn from them
Yes.
and create our own dental product or a niched product for a medical sector,
Correct.
and then look at how can we use the same product in across different healthcare sectors.
Mhm.
But for that, you have to train your mind to be curious, to be quite attentive,
Yes.
quite learning and observant. You
Yes.
know, so if it is a new graduate, I'd definitely be doing that right now, because anyways, you can't do a lot of clinical dentistry or anything. Also, look at learning finance,
Yes.
finance, leadership, change management, and also data science. So these would be, if I would have graduated now and post graduation was not on my cards, I'd definitely be looking at all these four things I have said, because the industry as such is changing and will change rapidly over the next 10 years because of artificial intelligence, augmented reality, virtual reality, robotics. There will be a constant change that will be appearing, and we are not taught at school, so we will need that extra skills coming from the from dental graduates itself.
Correct. Thank you, Padma, for this insightful conversation, and I think it's really nice to meet you, e-meet you rather. But I'm very hopeful that someday we will surely meet in person. And thank you for your time and for being here. And to all our audience, I hope you have got enough food for thought. So see real persons who are here with us. Dr. Padma is just on the earth, and she has just done what she wanted to do, following her vision, and she had fixed her goal and she knows where to reach. So I think thank you for this amazing inspiration and motivation, and we are very positive through your thoughts, and will definitely follow the learnings that we got from your entrepreneurial journey. Thank you, Padma, for being here.
Thank you, Gagi. It was great to share my experience and to meet you finally. And look, you've been an inspiration for me. Please keep doing what you're doing, and I'd love to meet you someday.